when it comes to digital health, you have demand from the public and you have tech companies that are willing to provide. But when it comes to Sweden, we have this principle that care should come first to the one who needs it most.
Yeah.
Firstly, you have like the telemedicine that involves the use of telecommunication technology to provide remote clinical healthcare to patients.
So like video calls with doctors.
The most perfect combination is doctor and AI.
Great. So it's not going to take the doctor's jobs.
And then you have health informatics, which involves collection, organization, and analysis of healthcare data.
How does that affect like compliance?
When you have this technology in your hands, you get much more involved and educated. You take control over your disease in another way.
Isabelle Cehlin, welcome to the Go Beyond podcast.
Thank
happy
you.
to have you.
Thank you, Joseph. Happy to be here. Looking
Awesome.
forward to the conversation.
Very much looking forward as well. Especially due to you have an amazing background in healthcare. You're a medical doctor in geriatrics. You've been working with digital healthcare as well and different tools and aspects of it to improve healthcare, which is well needed. And especially having a doctor working with that is more than amazing. So, before we dive into talking a little bit about, digital health, which this episode is going to be about, we would love to hear from you. And I guess our viewers would like to hear from you as well. What you've been doing, what got you into this field, and tell us a little bit about your background.
Thank you, Joseph. As you mentioned, I'm a doctor and specialized in geriatrics. But like 8 years ago now, I joined Bonnier. That's a large media house in Sweden. As CEO for a sort of a startup that provides primary care with clinical decision support tools, 100% digital.
And that's when we met.
Yeah, that's where we met.
Yeah, that's where we met.
Yeah. Then it was a startup. Now it's widely used in Sweden. I think it's about 80% of primary care has access to Medibas today.
And sorry for interrupting. So that's mainly for the doctors? Or,
mainly. But
mainly for the doctors. Got it.
But also other categories of professionals. As we then created Bonnier Healthcare in Sweden, I became responsible for also the largest non-governmental patient site with health information and also SaaS tools aiming to help pharma. So that's like broadened my views. And so the delivery has been like 100% digital, whether it's like decision support or communities for patients.
Yeah.
So now I'm at the crossroad. I'm starting as a CEO for the company in a couple of days. And this
Congrats.
Thank you. This is a tech company, so the tech area is new to me. But still, it's about providing SaaS tools.
Yeah.
Now it's like in production planning and control, still for healthcare. And I'm also a co-founder of the Swedish e-health organization for doctors. That is part of the Swedish Medical Association. And this organization aims to involve health professionals and mainly doctors in innovating in the digital health area, because we want to ensure the best outcome for patient and for society. Well, I think that's all for me.
I mean,
anything else you want to know?
No, I mean, yes, a lot. But, there's so many things I would love to kind of dissect a little bit more because you have such an I wish I had your CV. So let's talk about your...
You're humble.
Let's talk about your getting into the beginnings, right? Medical doctor, geriatrics, and now shifting, whatever, like going into another space, right? It's still healthcare, of course. Yeah. So why don't you tell us a little bit why medical doctor, geriatrics, and then I guess that kind of transition into, Medibas and the other things. Would love to kind of understand that a little bit. Yeah,
so you're wondering why a doctor focused on dementia end up leading business in digital health.
Exactly.
I can understand that. But I think it's all comes back to a will to make change, to do things better. I see big opportunities in digital health in improving access to care, in enhancing patient engagement, and empowering individuals to take control of health and their well-being. And I still do.
Yeah.
So this is just another way for me to execute that.
So empowering the patients at the same time as improving the overall quality and outcome of care through digital.
And I think as a geriatrics, you have like a view that you also have in primary care when it comes to the patient. You see the whole patient and the environment that they live in, and like their family and all the resources they have.
Yeah.
And you see that you can use this in a different way. So I think that's why it makes sense to me that I come from geriatrics and move on to how to use digital health for better outcomes for patients.
And for anyone who's listening in, because I have to be honest, like when I went to med school, I didn't know what geriatrics was until I read about what geriatrics. So why don't you tell our viewers, like just really briefly, like what is geriatrics to kind of understand?
Well, it's about understanding the aging process and the diseases in the elder population.
Yeah.
So it's what's so interesting is, of course, about how to treat multiple chronic diseases at once, and also how to decide when not to treat and when to maybe make different prioritizations in regards to the patient that you have in front of you.
Yeah. And that's sort of what you're saying is that's where you get this holistic kind of picture of what the patient is, right? Yeah. No, it's and then I guess going from an area which, you know, working as a doctor, being very close to a patient, like seeing patients. By the way, I don't know if you see patients anymore. Or like,
no, I don't.
So tell us a little bit about that. You know, that transition. How was that? You know, pros and cons. Do you miss it? Yeah, etc.
Well, sometimes I miss that you can make such a big impact for one person just by, you know, talking to them for like 5 minutes. You can make their day.
Yeah.
And the last position I was in as a clinician was I was diagnosing complex cases of dementia, and then you have to get to know your patient very thoroughly. So you have like an hour to interview them, which is like luxury for doctors nowadays. So I can miss that, you know, you have to be like a detective, truly. So I can miss that. But it also gave me a lot of frustration because you come in contact with all the administration and how badly we managed our resources and how unproductive we could be when it comes to administration. And I felt that I spent too much of my days and my time managing bad systems.
Yeah.
So high blood pressure and irritation. And I also have a feeling that maybe I can contribute even more in another form.
That's so interesting. So I guess that also worked as an incentive for you to now start looking in other areas in healthcare, right? So, and I don't know if you have like a specific moment when you were working, like, you know.
Yes, I do.
Okay, yes, you do. Okay, then please, tell us.
I can describe it. I was sitting at a hospital in central Stockholm.
Okay.
And like, you know, this empty room where very little furniture. Yeah, I guess, you know, the clinical environment.
Yeah.
And when you diagnose dementia, you do a lot of lumbar punctures. Lumbar punctures.
Yep.
You know, you take a fluid from the back of the patient. And like one day every week, I made like 15 or 20 of those. So it was like a routine for me to do it. But
15 or 20. I could barely do one, like I remember.
Well, so it was like I was sitting there and I for every one of those that I made, I had to fill out a form, a paper form. I had to dictate what I was doing. And I had to enter something in the electronic health record.
Yeah.
So for every patient, about 10 to 15 minutes. And for me, it was so obvious that like in 99 of 100 cases, it's like routine, nothing goes anything else than according to plan.
Yeah.
And you always order the same lab and everything. So this should be just automated.
Yeah.
So it should be that if there was like something went wrong, then I should do the extra work. But when it's like routine, I would just say like routine, and everything would go smoothly. So there, I remember sitting there and I had like this, doctor,
yeah.
and I have a doctor's salary, and I think this is not well spent money for the society that I sit here and do this. So that's when I decided I have to do something else.
Well, that's very responsible of you, thinking that I have a doctor's salary and that,
Well, I also pay taxes, so
yeah, sure.
you have to sit on both chairs.
Yeah. Well, very interesting. So that kind of idea of automation maybe as well, right? To reduce administrative burden as well.
And in healthcare, you have so little time, and you have so much to do that you don't have energy to see the opportunities to fix your situation, I think, sometimes.
Yeah.
So often when you came to someone responsible with ideas, it was like, well, I can't manage that now.
No.
So then you continue to work in bad ways.
Got it, yeah. And it continues to promote bad ways of working, then, I guess. Well, then, I mean, seems like you've definitely kind of transitioned into the right space then to make an impact. And one thing, I guess, before we move, one of the things that we're going to address in the beginning of this episode, and I guess we've already talked about a lot, is talking about the different categories, the basics of digital health to our audience. But before that, because you mentioned you're the co-founder of, I know it's the E-hälsoläkarföreningen in Swedish, so the e-health doctors kind of community that you've built, which I think is amazing, and I think we should definitely have that in more places in the world. So, tell us a little bit more about that, and why it's important that we engage with health professionals as well to have the impact we want.
Well, I think when it comes to digital health, you have demand from the public, and you have tech companies that are willing to provide to that regarding to that demand. But when it comes to Sweden and among other countries, we have this principle that care should come first to the one who needs the most.
Yeah.
So I think as healthcare professionals, we could do a great contribute to this, making the best of this transformation, so that we can provide digital health according to our thought system and policies in the society.
Yeah.
And we can't just sit back and be mad that the world is evolving around us, because it will.
Yeah.
And then it will leave us behind and our perspectives behind.
And is that something, because obviously the profession of doctors is a very well-respected profession most of the times, and people look up to you and what you're working with and what you're contributing to society. How do you feel digital health has now, because you're actively working within this kind of community, how do you feel digital health has impacted the way, doctors look at e-health and these solutions? I guess there's pros and cons, right? But still, like the general impression of it.
Well, I think there are a lot of clever people out there that embraces it and want to make the best of it, and can also see that it can improve both for the patient and their own working environment, and it can be great for resource allocation as well. But there's also like this misunderstanding that is mainly focused on cost efficiency and reducing personnel. So you can see it as a threat sometimes.
Yeah.
And not the least now with AI, I think it also challenge our role as a doctor.
But and isn't that also the fact that it's more about like evolving a role, right? It's not necessarily like taking away what you love, but maybe evolving it.
And that's why you have to be active and a part of the evolution and the disruption.
Yeah.
Otherwise, it will leave you behind.
Exactly.
So you have to actively evolve your role.
Well, talking about evolving and evolving the space of healthcare, then now jumping into this very wide subject of digital health, there is a lot of things, a lot of different subjects to touch on, but maybe if you can kind of break it down a little bit for our audience and viewers, what kind of different categories there are, if there are any, and kind of give them the basics of, what it's all about and how it works.
Well, if you want me to break it down to categories, I have some for you.
Yeah.
And we'll see if you...
Shoot.
That's what you were thinking about.
Yeah.
Firstly, you have like the telemedicine that involves the use of telecommunication technology to provide remote clinical healthcare to patients. You can have like virtual consultations or remote monitoring of patients' vital signs. Or even remote surgery.
So like video calls with doctors, I guess is what most...
And robotics, on distance. And this enables patients to access healthcare services in a way that makes it more equal to people who lives in more remote areas and who have like mobility limitations, or if you require more regulatory monitoring and you don't want to have this intrusion in your life. So that's one. The other is like, the wearable devices, such as smartwatches and such. And also medical grade. Yeah, of course, Garmin. Sponsored by Garmin.
Yeah, exactly.
And medical grade sensors as well. So that you can monitor health aspects in real time.
Yeah.
And you can track metrics like, heart rate and sleep patterns, activity, and even blood glucose levels.
Wait. I just have to ask, though, because we talked about sponsored, because I want to know what a doctor wears. So is it a Samsung or is it
it's a Garmin.
It's a
Garmin. But, I'm a trail runner. So for me, like,
okay.
You have
How do you like it? Like it's working well? It's tracking everything you want?
But I have a healthy heart, so I don't know anything about how good it is at tracking my,
Okay.
If I have a arrhythmia or something, I don't know how it reacts. But it has great control over my pace and so on.
So like for exercise, fitness and stuff like that. Okay, have you compared it to any other device, or have you only had Garmin so far? I have a boyfriend that buy technical stuff for me. Okay.
So it's like it's like that's what he thinks is the best one.
Okay.
So that's why I have it. Yeah.
Well, I'll see if I'll try it out. I have a Samsung, but it's maybe my heart needs another one. I don't know. Okay, we're getting sidetracked. But anyway, so you're talking about the categories. You talked about telehealth, wearables, and the hardware. Yeah.
Yeah, and this of course can, if you have a good one, detect early signs of issues, and maybe you can find conditions earlier and also reduce the need for frequent hospitalization. And then you have health informatics, which involves collection, organization, and analysis of healthcare data to improve decision-making, outcome, and delivery efficiency when it comes to healthcare. And here you have like electronic health record systems, of course.
Electronic medical records.
Yeah, and you have like mobile health apps as well. You were like in that area with the wearables, but this is more like when you talk about you can support delivery, patient education, self-management of conditions like symptoms trackers and like medication reminders and so on.
Yeah.
And lastly, a very interesting area, I think, is the digital therapeutics, where you can have like cognitive behavior therapy for depression, or like smoking cessation, and like virtual reality programs for pain management and such thing. Like then you really treat patients with those.
Wow, so like actually treating the patients with digital tools.
Yeah.
That's amazing.
So was that enough?
That's more than enough, I guess, for people also like listening in. Is again, like it's to kind of grasp how wide this field is becoming and how big it's becoming, right? Because one of the early things that was coming in was this kind of telehealth aspect, and even like, you know, calling doctors, which is in a sense a little bit of telehealth as well. But there's so many different areas, right, that we can look into to improve overall healthcare, make it more cost efficient, help the professionals, help the patient. But one thing that comes to mind, and I guess you've been thinking about this a lot as well, is how do we ensure quality and outcome of care? Because now that we're getting all of these devices and apps, and you know, we're spreading our wings essentially in the medical field, but in the medical field, evidence is very important, and the outcomes. So how do you ensure quality?
Well, that's tricky.
One,
and you also have to like put it into perspective on the risk you cause. Some devices might work on things that are where if you treat things in a bad way, you can make great harm, and other things maybe not make that great harm.
Yeah.
So it depends on what you're doing. But I think if you put it generally, regulations, of course, I think you would like to, you know, define.
How we love regulations in healthcare.
Well, I think it's great to, you know, define the box.
Yep.
Then you know that you can move around freely within the box. So I think regulations is key, and also, of course, that we have very different perspectives when we establish the regulations.
Yeah,
we can't be too conservative.
No.
But you need regulations, and you also need education, of course, both when it comes to the professionals using the devices or interpreting the data from the devices, and the patient, so they know about what they are doing and why, and the data that is collected, why is it collected, how, and for which use, and so on, so they can feel secure about the data as well.
Yeah.
So this is like the third important thing, managing the data correctly.
Yeah.
I think we have in the beginning of this area had a lot of, you know, well-meaning startups that have collected data in bad ways.
Like in regards to the way how securely it's kept, or like what type of data is collected, or
yes,
all of the above.
But all in the like with a good heart, of course, because you want to do something great for patient, and then you after a while you understand how important it is to keep the data secure and according to the regulations.
And you also mentioned something in the beginning that's very interesting, which is you mentioned that like some things might harm patients a little bit more than others, right? Is there anything specific you're thinking about there? Like, is it the digital therapeutics, or is it a symptom checker, or is it something else in regards to like how harmful it could be? Well,
I mean, if I mentioned like you have like this mobile health app that will help you to stop smoking. Okay.
Yeah.
So the worst outcome is that you don't stop smoking.
You don't stop smoking,
and that could be like, okay. Still, you have to, of course, manage data correctly, but the outcome, worst case scenario, isn't that bad. On the other hand, if you have like devices that could tell a person with a heart failure when to contact his doctor. That could be fatal. So, of course, we have different scenarios on what is the end outcome of the device.
And I guess, again, like that becomes, because you also mentioned the importance of regulation, right? So it becomes very tricky and challenging to regulate everything, because all of a sudden you do have the app store and everything, and maybe where you do get a recommendation, and how do you regulate I mean, it's crazy, to be honest, keeping track of all of that. Great. So what you also mentioned, data, right? Which is an important thing. What role does data play in regards to the outcome, and how, how does it help? How does it help the patient for, like a company like ourselves, for example, to have the data of patients? What does that help in the end for people who don't know?
Well, my main focus, so the number one thing I think of is how can it help patients?
Yeah.
And of course, when it comes to like personalized medicine and so on, the more data you can put in regarding your like genome and other stuff like medications and health history, then you can have a much more personalized plan for your treatment.
Yeah.
Such. So that's of course one, the personalized medicine. You have to have data to personalize medicine.
Yeah.
And then you have more like the broader view. If you have a lot of data, you can like on a population level.
Yeah.
More like define risk populations and so on, and you can manage your resources to put the intervention where they are needed and so on, and you can have this as a tool to provide higher equality in health.
So like epidemiological data informing your decisions, essentially.
Yeah. And then you can have, of course, when you can't identify the data, of course, and you can pool it together, and you can have like this population data.
Oh, yeah.
Yeah, you know what I mean?
The patterns,
you see the patterns,
yeah.
So more on a population
level.
Yeah. And then, of course, you have to have data to research and innovate. And with large numbers of data, you can have much more precise targeting treatments as well. Because, now we research mainly on males, white males, like 30 to 45 years old or something. And if you have
I'm getting there, so I'm going to be I'll be part of that group.
So if you have the possibility to collect larger sums of data in other cohorts as well, you have to you can have better research and better innovation, I think. Yeah.
So you essentially you need more data from varied backgrounds, ethnicities, etc., to get that entire, because it does matter, as you say, the genetics does matter, other things does matter as well. What in to kind of, I guess, maybe round off our section a little bit about the basics of digital health is, when you're new to this and the first time you hear about talking to a doctor online or via video, and the depersonalization of healthcare, essentially, because some people might think that, right, about digital health, and might be right as well. So, but like, what do you think are some of the major misconceptions around digital health and what it's all about?
Do you mean in healthcare professionals or in society?
Maybe the consumer more.
The consumer.
Yeah, the consumer, like approaching digital health, and like maybe the misconceptions around digital health.
Well, I think maybe in the public there are not so many misconceptions. Maybe because you are so used to digital technology, in your lives outside of healthcare. It's like default when you contact your bank or book like a hairdresser appointment, you're used to use it. So I think it's like more
I have
natural.
never booked a hairdresser appointment, so I cannot relate, but please continue.
So I think it's like natural to use digital tools.
Yeah.
But maybe the conflict lies in this that you have a demand, and you can have a feeling as a patient that now I have this access to a doctor or anything, and maybe you can overuse that access because it's so easy now.
Yeah.
But I think this is something that we as a society will have to like mitigate and find new ways to establish like a new balance there.
Yeah.
So it doesn't mean that it's a bad thing. Access to healthcare is a good thing.
Yeah.
But we just have to like have a common understanding around what to spend resources on.
Yeah.
And maybe also we will have more when it comes to Scandinavia and more entering when it comes to, other, if you pay out of pocket or...
Yeah. Because that's such an interesting and for our listeners in the next, I think in the third episode, we're going to discuss the health economics, which is now about like essentially there being demand for healthcare, but you always have a limited budget and what you can offer. So how do you think now, because that's a very interesting discussion, is how do you regulate that in that, yes, you are making it more accessible, so you can maybe talk to doctors, and of course doctors are a limited resource in sense. What do you think are some of the important steps there to make sure that maybe we don't abuse it or overuse it in that sense?
Well, I think the problem here is, I guess you say, technology eat culture for breakfast, right?
Yeah.
So I think we have like a quite accepted when it comes to Sweden, where we live, we have this common ground of values that we have accepted as a nation through, our politicians. We have politicians. We have a democratic process that leads up to. We have decided how to distribute our resources. But then you have like technology and business that finds new ways to meet a demand.
Yep.
And then you have to accept that and find a way to regulate. So you can find a new balance.
Got it.
So I think it's a good drive that we have this innovation in technology that drives us towards, because all those all these new ways to work and technologies, they provide us with a great opportunity to be able to continually provide healthcare to more sicker patients. So we have a big possibility lies there. But we just have to find a way to still have a vivid innovation, but regulate according to our values.
So what you're saying, it's very difficult to balance, but we can find a way around it,
and
right?
I think that's the only way. It has to work that way. You have to have this disruption, and then you have regulation.
Yeah. And isn't it also the case that, back to your story about automation and doing, trying to now free up time of healthcare professionals, hopefully now giving them more time to spend with the patients, right? And do other things. I mean, there's always this double-edged sword, as you're kind of describing here. Going to the fact about, digital health and the way it changes the patient-provider relationship, because obviously it does change it a lot, because all of a sudden you have patients, maybe annoying, coming in with a lot of data and their garments and their other things, and they know a lot about their body and they know what's going on, and that's it's good to be informed, right, about your health, but then there could there could also be a discussion about having too much data and too much information, and especially when you're going to your doctor. So again, very broad question, but how does digital health change the patient kind of provider relationship?
Yes. So the first thing I think about is communication.
Yeah.
It facilitates means of communication with your healthcare provider, both in like geographically, you can be somewhere else in space, and you can be somewhere else in time.
Yeah.
So if you have a demanding job, you can contact your doctor. Maybe he doesn't respond directly, but you can contact him in the evening or something.
Yeah.
So new ways of communication, which gives us another kind of relationship.
Yeah.
You don't have to be in the same room at the same time.
And this sounds like it's a very positive one as well, right?
I know someone. Okay.
Or the consumer.
Yeah.
Exactly.
I think often the consumer likes this because if they want to meet their doctor, they can often do that. So mainly this is driven with the best for the patient. If they want to stay home and don't have to go by transport for 2 hours and sit in a waiting room for another hour, they prefer to have it in their home. And also this, that you can contact doctors. You don't have to have a specific time that you have to leave work and so on, and maybe you need someone to watch your children or something. So mainly this is driven by demand from the patient, but also I think it can be positive for the work environment for healthcare personnel as well. And of course this also has effect on the access to care, because if in Sweden you sit somewhere in the northern parts of Sweden, you can still discuss your diagnosis with a specialist who mainly lives in the south of Sweden, where we have the big universities and so on. So you have access to more specialized care without having to travel or leaving your region. And also you have this, as mentioned before, you have this possibility of more personalized and proactive approach.
Yeah.
Because you can, with digital health, you can more specifically personalize both how often you meet your patient, or the patient meet your doctors, and how will the treatment plan look, and so on. You can more adapt it to what are your health goals, and not the society's health goals, and so on. And also I think it's like, on a more broader perspective, you have much more access to patient education. So you have a greater overall empowerment of patients. You have access to the same information that the doctor have. Like 20 years ago, the doctors had like this great information power, because you have all the information that the patient had almost none. But now
they were on a completely different level, essentially. Yeah. So
now you can have the same information that the doctor have about your disease.
Yeah.
And also it provides communities. I think you should not forget that you have now, if you have a quite rare disease, you are able to have a community with others with the same disease. Even if there are very few, maybe in your country or in your region, you can, through digital tools, meet others with the same issues. That's also very positive, I think.
That's such an interesting, I never thought of the community aspect in that. Can you give like an example of like how that would work? I guess you have a specific disease and then the community, like you can discuss it with them, or...
Yeah, I think one of the areas where maybe we are have a bit of a shortcoming in healthcare, definitely in where we live in the West, is that we don't maybe have time to meet the patient and discuss with the patient. We want to treat the disease or the diagnosis, but maybe we don't treat the person. But if you then, as a provider, can recommend your patient to a community where they can find others who have, maybe they have went through the same treatment, or they like have, if you are new to the disease, you can have like good conversations, and you can have tips, and you can like, you can have support from others who has been where you are.
Absolutely.
And also I think when I have been working with patient communities, I feel that a lot of patients find it very rewarding to help others as well. It is very positive feeling.
That's such a positive. I mean, that's such a positive thing. As again, like I haven't really thought of it that way. And going back to the now again, like the patient-provider relationship, right? And we talked. I mentioned data, and you mentioned this kind of difference in level of education and health, right? 20, 30 years ago, maybe. Is there a point where, or are we already there, where, too much data is not a good thing in the end? Or like can we ever get to that point? Are we at that point that like it's not good for the patient to have too much data or too much education? Or what do you think?
I think it's so much depends on the person, and you have to adapt. I know, especially as a geriatric, when you work with a lot of elder patients, they don't want to know. No. If I ask them, how do you want to do? They would like, well, you're the doctor. So maybe they don't want to get involved. While other kind of personalities, they want to know everything there is to know. And of course, sometimes there is still a reason why we have like a very long education as doctors, and I certainly hope that this still matters. So of course, much information can be something negative for the patient. But then if you have a good relationship with your doctor, I think this can only be positive. If you are able to discuss and clarify things. But you have to see who is in front of you. Does this person want me to carry it, or do they want to carry it themselves?
Well, I'd love to get your opinion on because right now it's also about not just data from digital health apps, right? You have data, if you want to call it that, from TikTok or Instagram and trends and social media, and that also becomes sort of a part of this umbrella of education within healthcare, right? But again, like, and this is where I think it gets a lot trickier, because obviously when you're a health professional, you said you've educated yourself. You've probably learned about evidence-based medicine, the evidence-based method, like how to find things, what is true, what is not true. So how do you kind of get through that and, as a consumer, filter what's right or what's wrong? Because that, to me, at least, I feel that's so scary with all these diets and all of this, and you should take that, and you should take this, and people trying to become very popular on social media. How and again, like, I don't know if you have the answer for this, but like, how should we tackle that issue or problem within health? I can tell you,
I don't have the answer.
Yeah, exactly. I mean, that's fine, but
still, I think
what do we do?
I think the younger generations now. Before we started here, we talked about children, and I think those that are in school now, for them, it's so natural to like check the sources and so on, and be skeptical about everything they read. So I think this is like a generational issue as well. And still, I think it also lies with us healthcare professionals to establish a good relationship. If you have a disease, if you have a diagnosis, and we know you have a diagnosis, then you have to establish like a communication so that you can have a discussion based on trust. This is like more interesting, I guess, if you don't have like a diagnosis, or more like, I don't know, should you eat gluten or not, and those things.
What's good for you? What's not good for you? Yeah.
And then, of course, now we are healthcare professionals, so we have to, of course, hold evidence-based medicine high and so on. But Also, we are talking about digital health now.
Yes. Yeah.
So what makes people feel healthy?
Mm-hmm.
That's also important, I think.
Of course.
So as long as it doesn't harm you, cost you any money or inflict harm on you, if it makes you feel better, then it's health for you.
Yeah. Yeah.
So that's also a perspective you have to be a little bit cautious about, I think. Yeah.
And isn't it also the fact that, I mean, it's good in a way that we are challenged in healthcare, right? Because yes, we are learning new things, especially the area of like longevity is becoming very, very interesting, right? Of like fitness and exercise, because all of a sudden now it's not just about reactive treatment, right? It's preventive, which is good. I mean, preventative care is good, but
it's essential.
It's essential. And you know, how far do you take it, right? And what's good and what's bad for you. But I mean, I think you put it very well, right? As long as it doesn't harm you, you check the sources, you're aware of it. But yeah, for anyone who's listening, please do check the sources, because sometimes they can be, I've seen things that scare me.
Yeah, definitely.
Yeah. Great. When we did, so this is also now when we're coming into the fact of personalized medicine as well, right? But we're already talking about it in essence, like how do you empower yourself, where prevention is very important. So what is, you know, again, like what is personalized medicine? What does that even mean when we talk about it as a subject?
Well, for me, it's like when you take into account individual variability when it comes to genes, environment, and lifestyle. So the goal is to tailor the medical...
Genes, environment, lifestyle.
Yeah. So you have to tailor medical decisions and treatments in regards to the characterization of each patient, and also, as mentioned earlier, what are their health goals. I think so many times, especially in geriatrics, we have treated patients according to the healthcare's goals, not the individual's goals.
No.
For example, you know, when you have elderly people with multiple diseases and they have like difficulty breathing or something, and you send them away to the hospital in an ambulance, and they don't want that. So what are our goals and what are the patient's goals?
Yeah. So having those two kind of things in consideration. So in regard to then personalizing your whatever, like personalizing healthcare for the patient, but if you now empower yourself to personalize that journey, right? Maybe you're using digital health apps that we talked about to track your data. Maybe you have a Garmin clock, whatever it might be. One of the most difficult things with that is, again, like how do you handle that data? How do you interpret that data? How do you use that data in your everyday life? Do you know of any, you know, good way or like a guide for people to use to personalize themselves? Like, is it to go YouTubing? Is it to go, you know, because again, like there's so much information to take in. Where do you start essentially?
Well, I really don't know. For me, the most fundamental part of personalized medicine is in the genomic data.
Yep.
And that is not something that you, see lightly upon.
No.
That's quite, it's very, data is very important to keep secure, of course. And if spread, it can cause you definitely harm. But on the other hand, you can like do very much when it comes to anticipate drug responses and so on. So you have like great possibilities, of course.
Yeah.
But I don't think that's what you are talking about. That's more like the hardcore personalized medicine. So if I should like just come to myself. I think once again coming back to my own personal health goals.
Yeah.
And have that as some sort of platform. For me, in my situation, it's more, and I guess also for you, it's more like prevention. How much do I want to invest in prevention? How much am I interested in investing in a healthy future for myself? And then, of course, it could be interesting for me to know again, when genomics, okay, have I a high risk of breast cancer or not? Or do I have a high risk of colon cancer or heart disease or whatever? So that could be like, but I think it's like more like a luxury consumer view of it.
Yeah, because it does cost money as well, right? I mean, it's not free in that sense as well. Yeah.
Now, of course, and if you are at risk and you can prevent that kind of disease, then of course you can save a lot of resources as well. But I think that's something that lies in the future more.
Yeah. Well, I mean, I think that's interesting, as you put it, is looking at your personal goals, right? And then maybe having that lead you in a direction to start personalizing your journey. And the thing about, and we already talked about this, is now the way digital health has impacted preventative care, the way digital health has impacted chronic care, because you talked about follow-ups. I just wanted to kind of touch on that a little bit. Do you think digital health makes it easier to take care of chronics, for example, people with chronic disease? And why is that?
Definitely.
In that case? Yeah.
Both since you are able to like monitor them in a good way. Like for instance, if you have a patient with diabetes or something, if you can see that they have perfect measurements, then you don't have to take them to hospital to have like a meeting with them.
Yeah.
So it's more like I can see that you are okay. Contact me if you have a problem. Then you are also able to like steer your resources where they are needed.
Yeah.
Instead of having a yearly visit for everyone. And also, of course, you have this possibility when you know your patient, you have seen him, you have like examined them physically, then you can have like this telemedicine contact just to check up. And check in how you are feeling and so on. So it's much more easy to have that type of communication when someone you already know. And you know that you can see if something is different or something.
Yeah. Because
you have already met someone in person.
So the tracking is easier, the looking at the outcome, and as you said, like the convenience in sense. But so does that also then affect... How does that affect like compliance, do you think, in regards to like taking your meds and these things? Is that also something that's improved, or?
I don't have any like statistics on this, but my overall assessment is that when you, as a chronically ill patient, when you have this like technology in your hands, it's much more real for you. Yeah. Like if you're like a diabetic and you have the pump and everything, and you measure your blood glucose continuously, it's a whole different thing than you have some nurse giving you injections, because now you own your own health somehow, and I believe that when you have this in your own hands, you educate yourself, and you can also see directly, I ate this and I feel like this, and I did this exercise and now I feel like this, and I can see my measurements. So I think you get much more involved and educated. You get more educated and you get more involved, and you take control over your disease in another way. So I think that is a good thing.
It's almost like a reward thing in a sense, right? Yeah, there's almost dripping dopamine when and it's like with your clock, right? And you see my steps or whatever, and like achieving something and so on. So
you get your direct feedback.
Exactly.
And then you also have just an anecdote. My boyfriend, he has a best friend who has a diabetes.
Okay.
and he has like this alarm on his app. So, okay, now his blood glucose is low. I have to give him a call to see if he's okay. So it's like something for the community as well.
That's great. I mean, it is. You become more involved, and you get that feedback, as you said. Like, and that's. I mean, you don't have to disclose that if you don't want to. So is that diabetes type 1 or
type 1?
Yeah, type 1. Yeah,
of course.
Again, like that instant feedback cycle, right? We're going to get into that, by the way, later. The vicious feedback cycle on like having these wearables and health apps, because it can also, I feel like it can be destructive sometimes, but it depends on how you use it, right?
Yeah.
We're going to get back to that. So like looking again, zooming out a little bit, the space on e-health and digital health, obviously there seems to be a lot of positive things to take away from it, right? So in looking at it from the other side, and I think we touched on some of them, but what do you think are some of the most, significant barriers in digital health and e-health right now, and just looking at it from a global perspective?
I think that if you are providing healthcare, I mean, that difference from different countries and regions, how much healthcare you provide to people. But if you're going to provide healthcare, then digital health is like accessible and affordable. So I can't see why that should be a problem. And I know you have the experience from different regions in the world where people still have access to smartphones and so on. But on the other hand, there is, of course, there's always a risk that you have like this demand-driven evolution where you have this. You have a consumer who wants something, and you have a company that provides something. Maybe not according to this principle about who needs it the most gets it the most. So that's, of course, one problem. And also you have like when it comes to AI, you have this bias when it comes to how you train the tools on, different.
The 45-year-old white males,
they have
getting prostate cancer.
You have the stereotypes, and the dermoscopy. You have like digital dermoscopy, and they are not trained on dark skin and so on.
No.
So this, of course, is like when you develop a product for a market, it get adapted to the market. And maybe then it's not the best to use in different markets where you don't have the same economical strength.
And that actually that goes beautifully into my next question, which is about online diagnostics, right? And on diagnosing patients online. So, how far can we go? Like how far can we go in diagnosing someone online? Now, whether that would be you talking to a doctor online or maybe an AI or chatting, whatever, like how far can we go?
Well, this, of course, it depends on the situation. You might have a situation where your only option is like a distant call or something. So you get the digital consultation or none at all. And then, of course, that is better than nothing. But I think like a guideline, the digital meeting is okay. Or maybe if you have a, like more of you're meeting a bot or something. But as long as the patient feels safe and the provider feels safe, then I think it's okay. But of course, I think we are now in the middle of developing this. So this is like the end goal. If the patient doesn't feel safe, then maybe you have to provide some other if possible, you have to provide some other means of contact. And diagnose.
Yeah.
But if you have both sides are convinced that this is a good product, then it's okay. But that's not where we stand now, because now we are still in trial and error.
And how does because I think it's very interesting for people listening in as well, is like, how does a doctor make a call in, let's say, when you do have an online consultation, right? How do you make a call if it's like, oh, no, I'll take care of you from home, or you need to, whatever, go to the emergency unit, or I need to admit you, or you need to see a doctor, like we need to do like a physical examination. How do you determine that from an online call?
Well, I guess it depends. If you have a lot of routine,
yes,
then you can like feel it in your gut. Something is wrong or something is right. And of course, you, as healthcare personnel, you always have to decide. You can't always be 100% sure of any decision.
No.
There can always be, someone is calling you with a headache. Okay, it could be something, but it's like a very, very minor risk. And then you have your protocols telling you that, okay, this can wait, and this we have to explore anymore, even more, and so on. So I think it depends on how senior you are as well, because if you are very new as a doctor, then you have to have more protocols to follow, and you have to be there have to be okay that you want to see the patient more often, and you want to have a second opinion and so on. So I think it depends, but I think we do this all the time already, that we decide how big is the risk to do and not do things. And you can do that as well in a digital call or something.
Yeah.
You have to use the same risk assessment tool.
No, and that's I guess this is now where like AI comes in as well, because what you're mentioning is you do have some kind of protocol, right? Of like, I'm going to do this or that. And from, what you learn in med school to what you learn in practice, and the more senior you are. So how do you feel about, obviously, everything that's happening with AI right now, with ChatGPT and Gemini, and there are other specialized tools in diagnostics? Can they do the work of a doctor, or is it more of a supportive guidance, treatment, whatever it might be? Like, how do you think AI will develop? Again, there's no right or wrong answer here, but like, how will it develop, and like, what can it do today?
Well, I think that the big problem today is that what's most important in medicine is to know when you have that feeling that, okay, everything looks right, but I know something is wrong. And I think it would take a long time for AI to be able to get that feeling. That
kind of gut feel.
The gut feeling. But I think, of course, what gives you the gut feeling can also be detected from someone else, someone else. So I think it's definitely possible. And I heard some interesting examples a couple of weeks ago. I don't remember the exact situation, but they had like a study with, I think it was drug use, and they had an AI to track. They had patients that should be without drugs, and every day they had to record a video, like a journal. And then they
just like talking about their day.
Like this was the day and so on. And then the outcome was that the AI was better than the doctor to predict if they were going to go into using drugs again. And that was because like a doctor, I think you have your way of thought. You were like, okay, maybe you can see maybe how are they mimic or something, I don't know. But the AI had no they were like open to what to look for. So they looked for when in the day did they record their message, and they can see a change in when in the day. So they changed like their routines, and that the AI picked up. So I think this is as an example that maybe AI also can see things that we don't see, because we have like our idea of what we should look for or not look for.
So like,
but the AI is more open. They can see all the data and see like the AI can see
things that we might not like.
So they can see patterns in everything. But we like focus on some different variables maybe.
Yeah. So like, for example, that we're biased in a way. Is that like a good way of describing it? Or,
we think we have like this pre-decided that this is the important things to look for.
These are like the conditions, and this is what I should do, right? Yeah. And the AI looking outside of that framework.
Because they are more open-minded to what could possibly be interacting.
Yeah. So would you say then, like looking at where AI is today, because obviously you mentioned this kind of gut feel, right? Which of course it comes from many things, right? It's from like the visual cues of a patient. It's from maybe touching a patient, an examination, and other things like. But the combination then of AI plus doctor, is that the way to go, perhaps?
Yeah.
Or, I mean, maybe that's the way of getting like the best results.
Yeah, far now, I think every study ever done has shown that the most perfect combination is doctor and AI. Better than both just doctors and only
alone.
AI. Yeah,
exactly. So they complement each other in a sense. Great. So it's not going to take the doctor's jobs, right?
No, I'm sure we can find a place for us in the future as well.
Absolutely.
I see a lot of possibility in AI to reduce administration and so on. So I think we can be able to do what we do best.
And hopefully a better outcome for the patient, right? And
better patient safety and better like data security and so on.
Another thing with digital health is inclusivity, right? Because you talked a little bit about the demographics. You talked about how studies are done and how you get the data and other things. So what about inclusivity in digital health data? Digital health solutions. Do you think that the only thing we're going to need is just for people to have a smartphone? Like, is that enough? And like an internet connection, and then all of us will be able to, access the same type of tools? What do you think about that? And I'm talking about mostly like a socio-economic perspective, right? Of accessing digital health.
Yeah, actually, I read something interesting today. That I think it was some study in Europe that showed that only 50% of the population were like digitally savvy or so on. And that was quite low.
It sounds low. Yeah.
I guess everyone uses maybe a phone, but on the level that you can like use any device, I guess. So I guess we still have a way to go there. So that's important to have in mind. And of course also you have to have many like when you develop new tools and so on, you have to keep in mind that people maybe can't see, can't hear, can't move and touch or anything. So of course you have to include everyone.
And interesting, just getting to that like study you read. So I guess, or I'm just guessing, was that mostly related to age, like the 50%?
I guess mainly, but also maybe you can have like different backgrounds as well. Maybe you're migrating or something.
Yeah.
I haven't seen the details, so I just reacted. I thought it was lower than I expected.
And like when we're developing all of these technologies, they sound fantastic and they improve and they do this and that, and we start using them in our day-to-day in hospitals or whatever it might be. Do you think we can become like overly dependent on technology within healthcare? Like, let's say the banks, their electronic systems, they shut down and, we have no freaking idea of what to do and we can't do a bank transfer. Do you think that'll become a problem in healthcare as well? That we'll become overly dependent on digital?
It's definitely a threat.
Yeah.
But at the same time, I think it's the only way, because if we don't use technology and this kind of innovation, we cannot provide healthcare in the way that we want to.
Yeah.
So I think we have to definitely balance this, to keep this innovation force in technology, but still you have to have continuous benefit risk assessments. And since we are now living in a world that have more another geopolitical situation, we also have to be aware that we can have data breakage or something. Maybe we did not think as much of that earlier on.
Yeah.
So we have to keep the innovation going, but we have to have a clear plan B. And also we have to have people working in healthcare to be educated about plan B and ready for plan B.
Yeah. So, and I guess that's at least in my mind, one of the biggest fears is that, let's say you do have this doctor AI combination, right? And then you become lazy in educating people in healthcare and diagnostics, and then all of a sudden you have no idea what to do when you don't have the So I guess that's what you're kind of alluding to. Yeah. No, it's but as you said, it's the only way forward as well, right?
Yeah,
we have to push. We push for that specifically.
At least in Sweden, we don't have our problem is that we don't have enough people to help everyone in the future if we don't use technology. So if we want to keep the standard of healthcare that we have today, or hopefully improve it, I can't see how we could do it without technology. But still, we have to have some kind of minimal level of healthcare that we can provide, even though everything just shit hits the fan.
Yeah. Well, I mean, that's such an interesting point you're mentioning, especially about the fact that not having enough healthcare providers. Because if you look at it from a global perspective, I mean, Sweden has among the highest amount of doctors per capita, and of course we do have listeners from Kenya, for example, and active in other regions, and they're going to listen and what the heck are they talking about? Why don't you have enough? But tell us, why is that? How is it that we don't have enough doctors to take care of?
Well, I think we have enough doctors.
Okay.
If we handle the administration problem correctly.
Okay.
But I think the basic problem in Sweden is that we are the most lonely country in the world or something. I think what you have in other countries are you have a social security network.
Yeah.
So if you get sick, someone takes care of you. In Sweden, we rely on someone who gets paid from the government to take care of us. And those people are a scarce source.
Well, you heard it here. People in Sweden, we need people around us to take care of us.
Yeah.
No, that's very true, actually. What you're pointing out, I guess that kind of network exists in a different way. So, is it more? Is it also in relation to challenges in mental health as well, or do you think that's relatively same across?
I think that's the same. But also I think in Sweden and other countries like ours, we have this, to become a caregiver.
Yeah.
Okay, of course, becoming a doctor is still quite, some people want to become doctors, but to be a caregiver, that's not very high status.
No.
And it's not very well paid. So maybe I think someone said that if like everyone graduating from school, like the next 10 years or something, went into caregiving, then we could manage maybe. I don't think they want to. No. Not everyone. So that's like the big problem.
Got it.
It's not high status now. I hope it will become again.
Yeah.
It was like in the 60s and 70s, it was high status. Now it's not.
Well, that's true. It's interesting how that fact can change in regards to the, I guess, demand for healthcare, in fact. Well, to round everything off, this podcast is very much, as we say, it's about going beyond traditional healthcare, exploring what's next. And obviously, we've been discussing a lot about what's going on in digital health right now and what's being developed. So what do you think, like looking the next 10 to 20 years maybe, like in what's going on now with AI, with digital health, what do you think will be some of the more kind of impactful areas that digital health will contribute to? Or let's say that you're most excited about. Maybe it's Garmin 25.0 in the future, right? Like let's say, what are you most excited about for the future of digital health?
Well, if I see like in somewhat a short perspective, I see that we can have like a monumental impact with AI when it comes to administration. I think for caregivers in Sweden and both doctors and nurses and whatnot, and also in other parts of the world, you almost 50% of your workday makes up administration. So if we can like free this time with help of AI, for example, I think we could both improve the quality of data. We could improve data security, and we could improve outcome for patients, and they could feel more seen and heard by their doctors. And also I think you can create a much better work environment for doctors. Because they don't have to sit for 4 hours every day and dictate and fill in forms and so on. So I think this is something that is quite tangible right now and can have a big impact.
Freeing up that time and using it.
Yeah, you can do the reason why you went to med school. You can do that in your days instead of sitting in front of a computer.
Very true. And then so that's something very tangible right now. So when you're looking at your Garmin, when you're looking at what you're doing, everyday stuff, like what do you want to see happen? Like what do you want to get out of that in the end? Because we're coming to the subject, and something I'm very passionate about, and obviously in an organization, is about longevity, and it's about prolonging quality life years and taking care of yourself. So how do you think that will develop? And what do you want to see in that area?
Well, if you see like most, I think we have a lot of bigger problems to solve. But if I could see like my luxury problems, I would love to, since I am healthy and I take care of myself, I would love to have this more personalized. Maybe I can see, like in relation to what I have eaten, how do I feel, like more collected data from everything I do, both activity, sleep, what I eat, and you can I think you can source a lot of this data, but you cannot today interpret it in some way that make it very easy to take action on it. So like the interpretation of data, I guess. I would love to have an app that could actually just like take a photo of what I eat. And then you can see the next day, oh, you ate this and now your blood sugar and blah, 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 blah. Because now if you want to know how much protein you have eaten and so on, you have to like fill it in, and you don't. But if you could just like take a picture, and they can like calculate if I have enough protein and if I have enough the vitamins and so on. That would be great.
That would be easier to track.
Yeah.
And I mean, I get your point, like, because you have these lifestyle and wellness apps, and then like you're not going to input all of that data. But I guess that's why it's so good with the wearables, right? You get that data right away.
And they could be better as well at detecting sleep, because I have seen a lot of times that I have been sleeping according to my watch, but I know I have not been sleeping. So, everything is in progress.
Yeah.
But it would be very cool if I can, if I could have more intelligent interpretation of all this data.
Yeah. There's actually, so please, this is not based on evidence in any way. So this is more kind of anecdotal. I saw that there was there's several patents right now that are being signed for wearables that can detect molecules in your blood. So now, and this is already underway, we're talking about detecting glucose molecules, talking about detecting fat molecules as well. So, I mean, we're literally now maybe, starting to look at even lab tests or some lab tests being interpreted, but like from a wearable standpoint anyway.
That's great.
What do you think? Yeah, I mean, what do you think about that? Yeah, I mean, because then it's even more data, right?
Yeah, if it's reliable, it's perfect, because you don't have to like penetrate the skin and so on. So that's perfect.
Yeah. No, I mean, and then all of a sudden you would get data over time, like even daily data, and then you would have your algorithm tell you what to do and what not to do. I mean, it's a very interesting area and it's developing very, very quickly. In essence, going back to the fact about genetics, because you did mention that, right, several times. How do you think that will play a role in the future, right? Because you talked a little bit about, your predisposition for breast cancer, for example. I guess there are several things in your genes that we don't know now, but that we'll probably know maybe in 10 years or 20 years. That will, it will predict how your blood glucose levels will develop, or how much fat you have in your blood, et cetera, et cetera. Like, again, that's going to be extremely sensitive information about individuals. How do you think we'll go about all of that? Very broad question. Like, again, 10, 20, 30 years into the future, right? Do we have data banks from hospitals, or should it be personalized that, only I have that information on myself?
Well, I really don't know. But I think, of course, even now you have like very wealthy people who do like this whole full body scan every year or something to see tumors and whatnot.
Yeah.
You can discuss if that's like a smart way to go about your life or not. But on the other hand, they have the economic means to do something about what they find.
Yeah.
And of course, as now this type of diagnosis and treatments also are very expensive, but you can see in the future they will be both cheaper and more accessible.
Yeah.
And then it will be like more of an interesting crossroad where we decide to use this on a broader population. And also it depends very much about the policies of that region or country and so on, because in Sweden we have like this we provide healthcare free, but if you're in a country where you have to have healthcare insurance or so on, then you are much more that puts you in a tougher position, of course. So it depends on what type of political environment are we discussing this.
and what do you think, like, because that's also an interesting aspect is, okay, like, again, we are developing in a way where we're personalizing medicine a lot and we get more data. How much do you think government should fund? Like, what's healthcare? Like, let's say in Sweden, right? Free healthcare, free access, etc. Well, to what extent should we fund these things? Because obviously preventative care is very important, and taking care of yourself. Do you think, that's something that will develop where we finance even wearables and hardwares to people, or how do you think that will develop? Again, very kind of explorative, right? But
I guess the big problem here is that the people who want to invest in their health, they do it independently on whether the government give you a watch or anything.
Yeah.
So I think, in Sweden we have this, you get from your employer like money to go buy gym card or something. And I think the studies show that the people who uses this system, they would have been exercising even if they didn't get this extra money. So I don't know if that's the best way to attack the problem. I think it's more about, building another kind of society where you can walk more freely, and maybe you don't have the escalators closer to the entrance. You have the steps instead, and so on, the stairs instead. So I think it's much more other things that you have to look into when it comes to general well-being.
Yeah. Because, and I don't know how much you know about this particular subject, but let's say, for example, whether it's in the US or, for example, in Africa and Kenya, and you talked about health insurance, right? Playing a big role. Because there, now you're paying a premium to access healthcare. And then what's now starting to become more popular among insurers is that you do have some kind of an incentive program, which means that if you follow a certain lifestyle and wellness plan, your premiums are going to lower, right? Because you're going to be healthier. And then, of course, people are incentivized because, hey, I'm paying less money for healthcare. Do you think Sweden is going to do the same thing with looking at government, looking at subsidization? Like, how do you incentivize the population if you don't have the health insurance, let's say, perspective?
Well, I think it's very hard. I think you have to sort of like build it into the system. Like you have to walk and you have to take the stairs and so on. And maybe if you provide nutritious food in schools and so on, and you have not access to other stuff, because I think the people that need to improve their health the most, they have more urgent problems to deal with. That can be like mental issues or drug abuse or other kind of abuse and so on, economical situations and so on. So maybe health isn't their top priority, because health is something that gives you negative feedback in the years to come, not right now. So I really don't know. That's something that everyone is like...
Yeah. And I guess
that's like a Nobel Prize question.
Exactly. Well, I mean, you could be the one running for a Nobel Prize. Who knows? Eh?
I would like to go to the party. If someone wants to invite me.
Let's okay, good. So there's an official invite here. Isabelle said that whoever wants to invite her to the Nobel Prize party, she's here for it. Actually, I'm here for it as well. I would love to go. We've been discussing many things. I think we've exhausted the topic of digital healthcare, but for everyone who's now listening, it's been a long discussion. We've been looking at different subjects. If you're someone who is listening into this podcast right now, a viewer, and there's one thing that you want them to kind of take with them from our conversation about digital health, what would that be?
It would be to reach out to someone else that is interested. Not interesting. Interesting as well. But interested in the same topic. Because I think here in Sweden, definitely, there are a lot of doctors sitting out there in GP offices and this would be cool to try, but I don't know how to take my next step and so on. So if you're interested in this kind of topics, reach out to someone else who's also interested, and you can move on forward together.
Yeah. So if you're a health professional, get engaged, reach out, right? Because there's a lot of brilliant people, such as yourself, working within this area. And honestly, this has been a blast. I would really like to thank you for all the time and coming here, Dr. Isabelle Cehlin. It's been a pleasure.
Thank you very much, Josef. Very nice to meet you again.
Likewise. Thank you.